Okay, hi, good morning. Today I'm going to talk about different dental surface. I'll start with the dental filling. Usually, the patient comes with a decay or caries in his teeth. So, if it is simple, we can remove that decays and caries and put some kind of filling. It's called composite filling, okay, to seal the tooth. Now the tooth will be sealed. There is no more cavity to accumulate the food, and at the same time you stop the caries from spreading. The tooth will look natural, white and perfect. Okay, this is called dental composite filling. Now, scaling and polishing. Scaling, it's cleaning. It's mean you remove the scales out of the tooth. You remove the tartar. You remove the plaque. So this is called scaling. It has been done by special devices, okay, like this one, to remove the scales out of the tooth. Okay, so the tooth at the end will look white and clean without the tartar, without the plaque, because if you keep the plaque for a long time, it will irritate the gum, make it bleed and make it swelling red, and later on in long term it make gum recede away from the tooth, so the tooth will be wiggly. Okay, so this is like routine dental surface. We make it every 6 to 1 year. Usually we make cleaning, then polishing, then checking all the teeth, like if there is decay, if there is broken filling, anything. Okay, so this is scaling and polishing. Now, teeth whitening. Teeth whitening, it can happen in the office, or in the office it look like this. Okay, so we put the activation material in the patient mouth, on the teeth, and we activate the device. Okay, it take 45 minutes to 1 hour, and the result is really nice. Okay, so it make the yellow teeth white teeth. The only side effect that it make a little bit of sensitivity. It might happen, it might not happen. So this is the office bleaching, and the other kind is home bleaching. In the home bleaching, we have to take impression, which is mold of the teeth, send it to the lab, and when the lab send it to us, we provide it to the patient with a bleaching gel, so he can use it at home. So this is whitening in brief. Now, what is root canal treatment? Root canal treatment is when the decay or the caries, it's has been gone further next to the core of the tooth. Like this is tooth decay and infection. When the caries, it's approached to the bulb, which is the core of the tooth, it will irritate the bulb, which has contained the nerve supply, blood supply, and it creates infection here. So this must be so much painful. So how to do this? How to treat that? We need special devices to go inside to clean the tooth from inside. Okay, like this one. So we clean it, disinfect it. Later on, we put a filling inside. So that filling is supposed to be sealed, like from this part and top part. Okay, so in the x-ray it will show like this. Okay, that's mean when you find this white lines, that's mean it has been root canal treated. Okay, now every root canal, now why you do root canal treatment? Because you want to keep the tooth, right? If you treat the tooth like this, it will last for a long time. Okay, the other option, if you have infection here, is to remove a tooth, so you'll have a gap. So instead of removing a tooth, you treat it, you seal it, and you keep it. But the only disadvantage, or the thing that you have to keep it in your mind, that every root canal treatment, it need a crown, dental crown or cap to protect it, because the tooth now is fragile. So what is dental crown? I will take you to the dental crown. Dental crown is cutting a little bit from every surface of the tooth to put the crown. As easy as that. Some people they call it a crown, some people they call it a cap or covering, and really it's good. It's helped a lot of situation. Now in the old generation there used to be metal inside the crown. Okay, the new generation there is no metal, it's a pure ceramic. So this one is old fashioned, this is a new fashion. This one is cheaper than this one. Okay, usually I provide this kind of crowns to my patients. Okay, you must heard about dental bridge. What is dental bridge? I'll explain to you in brief. Dental bridge is when you have a missing tooth. You lost one tooth because of decay, failed RCT, or fight, for example. You just lost a tooth, or you don't have tooth at the beginning. Okay, so what we do, we cut a little bit of here and we cut a little bit of neighbor tooth. Okay, and we'll provide you with a 3 unit attached to each other. 1, 2, 3. So this one, it will come to this tooth, this one will come to this tooth, and this one will compensate for the gap. I hope that's really clear. Okay, now I would like to show you what is dental implant, then I'll come back to compare between dental implant and dental bridge. So dental implant, it's a surgical procedure. We use this surgical procedure when we don't have a tooth, like you have a gap here, okay, for example. So you insert the dental implant. This part is called dental implant, and this part is called the crown over implant. Okay, now when you have a missing tooth here, so we place the implant, then we place this is the abutment, then later on we put the crown over it. Okay, do you think, now if you compare between this one and the bridge, let me take you back to the bridge. Okay, so do you think you have missing tooth here and you have missing tooth here, but in option 1 we cut a natural tooth, one before, one after, to place 3 units. Okay, here we didn't touch any neighbor tooth or teeth, and we just put the implant and we compensate the space with one single crown. So in your opinion, which is better, this way or that way? Okay, let me tell you what I think. And this one is a little bit aggressive, so you have to prepare this tooth and this tooth, okay, and you have to fabricate 3 units. Now those cutting teeth, they have lost their natural tooth structure, right? And when you put the bridge here, it's not easy to clean because they attach to each other. So either you use super dental floss or water floss. Okay, but here, if you can see, it's only one single tooth, so we haven't touched those 2. Okay, this is natural teeth. Okay, we haven't touched it, we just put the implant here and we place the crown over it. So cleaning wise is easy, aesthetic wise is better than that one. Okay, the cost, it will be the same, because this one, it costs with the crown, it costs like this one. So what you prefer, like you will choose 3 units or you will choose 1 unit with the implant? Please let me know. Thank you so much for watching, and I hope I explain it in simple words.